So my very first question is, where are you from?
So I'm from Toronto, Canada. My background, though, is Nigerian. So my parents moved to Canada from Nigeria over 40 years ago. So my background is Nigerian, but I live and was born in Toronto, Canada.
Okay. Why chiropractic?
So always when I was growing up, I knew I wanted to be a doctor. I just didn't know what type of doctor I wanted to be. I was heavily involved in sports, and I knew I loved the human body. I loved how it worked. I was really good with my hands when I was growing up. So I knew I wanted to be a doctor. I just wasn't sure, and I knew I didn't want to work in a hospital. I also knew I didn't want to be like in a family practice or something like that. And I was looking for a way that I can combine my love for like being hands-on and touching things and putting things together, but also my love for like science, anatomy, and health and bio. So I figured that I was probably going to do something in physiotherapy. That's all I really knew at the time. But having two very traditional Nigerian parents, once you say you're going to be a doctor, that's what they're expecting.
Right.
So when I was in my third year of university, I was working at a clinic as doing like kinesiologist type stuff, so helping with patient exercises and things like that. And they had a chiropractor on staff, a female chiropractor on staff, and she was doing exactly what I wanted to do. And I was just like, wow, this is awesome. She's a doctor. And she's doing what I want to do. She's hands-on, she's treating people, she's treating injuries. And then I was like, yeah, this is exactly what I want to do. Chiropractic is what I want to be involved in.
Okay, great. So what is your educational background?
Yeah, so I went to York University here in Toronto, and I did the Kinesiology and Health Sciences program. So that's a 4-year program, a Bachelor of Science program. So I did that. And then I went to CMCC, Canadian Memorial Chiropractic College here in Toronto, and I did the 4-year chiropractic doctorate program as well.
Okay. So of course that leads me into my next question. What chiropractic school did you choose? So what made you choose Canadian Chiropractic Memorial College?
Yeah, so a couple of things is obviously like going into chiropractic college, you know what the cost is going to be. So you know it's going to be expensive to go to school, right? It's very rewarding, really fulfilling, and you make good money when you're done, right? But it's expensive to go to school. So that being said, there's only 2 chiropractic colleges in Canada. So one is CMCC and one is a school that's in Quebec, but it's a French program. So I'm not fluent in French, so it's taught in French. So I applied also for NYCC. It was the next closest chiropractic college to home. So I got in there, but their interview process and everything was before CMCC. So ideally I wanted to be able to stay home just to save on the cost. Also, I'm going to be practicing in Canada, right? So you hear about like the passing rates of the board exams as well. And ideally, when you're practicing in the same country, when you go to school in the same country that you're going to be practicing in, it's usually you have a better success rate at passing the board exams as well. So I knew I was going to be practicing in Canada. So ideally, I wanted to go to school in Canada. So when I did get into CMCC, it was awesome because one, I was able to stay at home with my family while I was at school. So that cut a lot of the cost. Yeah. And as a Canadian going to an American school, I would actually be paying an international tuition rate. So it really cut down on the cost as well. So, and then the other reason is CMCC, and I don't know if this made my decision, but when I got into school, I was very happy that I decided to go there. It was a very evidence-based school. Right. So a lot of the things that they teach us, and a lot of the ways that we practice, and even into when we get into our clinical year, it's very evidence-based teachings and practices. And that's one of the ways that I really try to teach when I'm in my clinic as well. So that's another reason that I'm very happy that I chose CMCC to get my chiro education.
So do your patients, do some of your patients speak French, or is just in Quebec area where they speak French?
Yeah, it's a very highly francophone province. So a lot of that province a lot of their programming, things like that, is done in French for sure. Not so much in Toronto though.
Okay.
Yeah.
How was your chiropractic experience at school? Because I noticed for me being a minority, it was a little bit
Mhm.
different. So I just
Mhm.
want to get like, how was your experience?
Yeah, 100%. So I was the only Black person in my year when I was in school. The year above me, there was one Black person, and the year below me, there was one Black person. So in time when I was in school, and let's say there's about 200 people per class, roughly, maybe like 180 to 200 people. So if we're saying, and about 800 people in the school, you probably saw 4 Black people in total. So yeah, you're definitely the minority. When you see it's like when you see someone that looks like you, you're like, oh my God, you look like me, right? So and then also we're talking about health, and you're about to go into public health and helping people into the public. So when a lot of the things that we're teaching, it doesn't relate all the way back to you, right? So then
Right.
we're talking about heart disease, and we're talking about lifestyle factors, and we know that sometimes African Americans or African Canadians were on the higher end of a lot of those diseases and things like that. So when they're talking about things like that, we're talking about rates, but it doesn't relate back to who you are and to your community 100%. So even when I got out of practice, or sorry, while I was in school and getting ready to get out of school, seeing that there were other Black chiropractors was so amazing to me. I was like, oh my God, you're Black and you're a chiropractor, because I didn't see any of that. I didn't see that reflected in my professors. I didn't see that reflected in my classmates, in our lecturers. That wasn't reflected in any of my schooling. So it wasn't until I was able to get out of school that I was able to see that. And then also in terms of patients while you're in school, it's amazing to be able to teach our community about chiropractic and to have people that look like me seeking my services.
Right.
Was actually on the CMCC's like student body Instagram the other day, and I know that I saw a lot more faces that looked like me, and they were actually having like a Black History celebration at the school, and that's something that wasn't that really advertised when I was there, and this was about 4 years ago. So I love when I saw it. I actually was so like my heart was like just filled with joy, because I was just like, I'm so happy that they're able to have things like this, because it wasn't these are not things that I was able to experience when I was in school.
Did you start off with your own practice after graduating, or did you start off in an associate? And how has your experience been so far?
Yeah, so I started off as an associate. The way I practice now is a little bit twofold. So I work at one clinic called the Health Institute. So I'm an associate chiropractor there, and then I work in what would be described as like a private hospital. So it's a hospital for patients seeking healthcare for addictions, and it's an addiction services hospital. So I also have a practice that I run within there. So it's really two ends of the spectrum, where one I'm in more of a community-based chiropractic office, and then I'm in a hospital setting that is treating people who are there seeking recovery from addictions.
Wow. Okay. That's interesting. So how does that work? How does that go hand in hand, like with chiropractic, working with those patients?
Honestly, it's been amazing to work there. I started working there while I was in chiropractic school. So I started working there as a physical health instructor, so just helping with exercise and things like that. And then eventually they opened up a clinic, and I asked if I could work in the clinic as a chiropractor. And a lot of people are dealing with pain. So we know about the opioid crisis. We have it here in Canada. I know you guys have it in the States as well. And a lot of times what triggers that is some form of pain. Like most times people are not taking these drugs for the sake of taking these drugs. It's back pain, headaches, any type of muscular, neural pain. And then it sparks the addiction, right? So these people are coming in with a lot of pain, and chiropractic is one of the services that we use while they're not able to use that drug of choice, and while they're getting recovery and trying to find ways to kick the addiction. We're helping them find ways to be able to be pain-free, move well, help with stress relief, things like that while they're there. So it's actually been really rewarded to work in that kind of environment.
That's amazing. Like I've never heard of like, a chiropractor working and a clinic with patients that are dealing with addiction. So that's definitely something I think a lot of chiropractors should look into.
100%, 100%. I'm always looking at the research to see if there's ever more research on chiropractic, and we know there's so much research on chiropractic and pain, right? But in terms of the addictions, there's not much research and not much that's linking the two. But just in the purest sense of what we do is we help people who are in pain.
Right.
So it really goes hand in hand.
How long have you been practicing?
So I've been practicing for 4 years now. I graduated in 2016, so I've been practicing for 4 years now.
Congratulations.
Thank you.
At some point in time, do you want to have your own practice? And if so, do you kind of have a name for it?
So this is something that I go back and forth on a lot. And I think the short answer would be yes, I definitely want to be able to have my own practice. I think it's really important for there to be visibility of minorities, Black minorities, and the minority females to be business owners and have and run their own practice. But right now, where I am right now, I'm really enjoying, especially working in the addictions field. I'm really enjoying that. And I'm really enjoying my other clinic, which is more of a community-based clinic. So it would have to be something that would be the right fit for me and the right timing for me. I haven't thought about a name, but yeah, there's a couple of other things that I'm looking into getting started. So if it's the right time and the right opportunity presents itself, definitely.
Are you certified in any special techniques like ICPA, sports chiropractic?
That I would say use a lot is acupuncture. So I'm a neurofunctional acupuncture provider. It's a therapy that I use alongside my chiropractic therapies a lot. It's one of my favorite things to do with my patients. So yeah, I'm certified in that, and it's probably, besides exercise and actual chiropractic adjustments, is probably one of the most effective things that I use with my patients.
And what drew you closer to choose acupuncture to get certified in that?
A couple of things is one, I had it done on myself. So I knew what the effects were, and I knew how it made me feel when I had it done, and I knew how it helped with my injuries. And then also just the science behind it, right? Especially coming from a neurofunctional model, which I like to think that I really treat within. It just made sense for how I wanted to treat people in terms of the nervous system controlling all things. It was another way for me to be able to access the nervous system in a safe, it is invasive, but in a safe way for my patients. And it's honestly been a huge addition to my practice.
I'm gonna have to try acupuncture because I don't know. I'm like, it looks really cool and interesting.
Yeah.
But the number one question is does it hurt?
Yeah. So you know what? That's also will be the number one question of the patients. Especially for people who have not had it, the number one question is, does it hurt? And it's because the idea of a needle has been ingrained in us from going to your doctor's office and getting a hypodermic needle. So this big needle that is meant to actually break tissue so that it can inject whatever it is that needs to be injected. The thing with an acupuncture needle is, one, the size. It is so much smaller than any kind of needle that you will get at your doctor's office. I show it to my patients sometimes and they're like, oh, that's the needle? I can't even see it. And I'm like, that's how small it is. Right. The other thing is it's not meant to break tissue. It's meant to go through fiber. So it's not meant to break tissue like a hypodermic needle is meant to break. There's going to be areas that can be a little bit more sensitive than others. But for the most part, and if you're getting it done by a practitioner who knows what they're doing, it should be generally comfortable. I'm not going to say all points are comfortable, but it should be generally comfortable.
So how long did that take for you to get certification?
So that's a 6 months course. It's taught here at the University of McMaster in Hamilton. So it's a 6 months certification course.
Okay. Interesting. I need to look into that.
Yeah, definitely do.
What type of techniques do you use in practice? Or I would say what are your favorite techniques to use? Because I know each patient is different.
Definitely. So at CMCC, we're taught more of the diversified method.
Right.
And that's pretty much what I use in practice as well. So yeah, I do a lot of adjustment. I do a lot of manual adjustments. So I don't use activators or anything like that in my practice. I'm not against it, but that's just, I just prefer using my hands when it comes to adjusting.
Yeah.
I do use some drop pieces as well to adjust, but mostly using the diversified method. So adjusting with my hands, doing also extremity adjustings with my hands. Yeah, so that's pretty much the method that I use, doing some soft tissue as well. And then my biggest thing that I always will promote with all my patients, and all my patients know that they get exercise. Like everybody has to learn how to move. Like
Yeah.
that's the biggest thing. Like strength is so important. So that is pretty much the main things that I'm using when it comes to treating my patients.
Even though you don't use activator, how do you like not stress out your hands since you use them so much on an everyday basis?
Yeah, that's a great question. And get stronger. Like that is the one thing that I will say. I remember my first day of my clinical year, I maybe had 5 patients scheduled. Like on the first day, maybe like 3 on the second day. It wasn't anything. And at the end of the first week, my forearms were so tired. They were sore. And this is my first week in clinical in school.
Yeah.
And I was like, you want to be in a busy practice. You want to be seeing multiple patients a day, like seeing 3 people a day over 5 days. Like that's not much.
Right.
So you really have to get stronger. My trainer is awesome and he really works on grip strength. One thing I will tell all chiropractors is work on your grip. It's so important to work on your grip strength, your hand strength. And then also as your numbers start to increase and you're treating multiple people a day, your body will start to adapt to it. So you will get stronger. But like I tell my patients, you have to be able to be as strong as what your profession is. So a chiropractor can be a very physical job. So if you're not working on your strength, you're going to probably tap out early. And I knew a lot of my teachers and my clinicians in school who retired because of injury, right? And I never wanted to, I don't want to cut short my career because of injury. I want to retire because I'm ready to retire, not because I have to. Because then I know clinicians who are in their 70s and 80s who are still practicing and in full practice, right?
Yeah.
So you really, really have to work on your strength. It's super important, especially as female practitioners as well, right? Because a lot of time you may have patients who are bigger than you. And what are you going to say if a patient comes in and you're going to say, oh, sorry, well, I can't treat you because you're bigger than me. It's like, no, you're going to have to figure out how to use your body, how to use techniques, how to create leverage so that you're not using too much force, so you're not tiring yourself out. But at the end of the day, we have to do what we're preaching to our patients, and it is about getting stronger. What I find that you'll realize is a couple of things. One is definitely always going to be the strength and getting stronger. But the other thing is you're going to learn how to use your body. Sometimes I have my patients be like, oh my gosh, your hands must be so tired. And I'm like, I'm actually not using much of my hand at all. I'm just putting a lot of my body weight on top of a patient. So instead of using like actual force that's coming from my hands, my forearms, because we got to protect your wrists. And one thing that I learned in clinic, I had one of my clinician supervisors, he docked me marks on one of my treatments because my wrist was in a very awkward position. And I was like, I thought I aced it. I was like, what, like, you know, you have your patient, they're marking you. And I was just like, what do you mean? He's like, you're not going to be able to practice like this forever if you keep doing this. And I was like, okay, so that always stuck with me. So you'll find ways to use your body and little tricks and things like that start to take a lot of the load off. I know when I'm starting to get lazy, because that's when I start to feel stuff. So when my techniques are starting to get lazy, that's when I'm feeling a little ache and pain there. But when I stop being lazy and then use your body and you find these tricks, you'll realize that like now I can see it doesn't matter how many patients at the end of the week, and I'm pretty much good. You might be fatigued because it's been a long week, but aches and pains, that's what you want to prevent.
So my next question was, are you personal injury, wellness type practice?
I would definitely say wellness. One of my biggest things is to improve quality of life, right? So it's not always, and when you graduate, you're very pain focused. Like that's what we're taught. We're very pain focused. But at the end of the day, pain has to do with all areas of life. So ideally, I want to be able to improve people's quality of life. So
Right.
definitely more of a wellness-based practice.
What is your ultimate goal to achieve as a chiropractor?
Oh, a couple of things. One is, like I was saying, I want my patients to feel like to have a little bit more autonomy over their health, right? I always, yeah, they're their doctor as much as I am their doctor. So if a patient leaves and they feel like they have a little bit more control over their health, then I think I've succeeded in what I've set out to do. So that is one of the number one things. Another thing is I just want to be an example for other female chiropractors who look like me,
Right.
right? And I want them to see that, yes, you can do this in a field that is highly filled with people who don't look like you. Because I didn't get to see a lot of people who looked like me when I was coming up. So I want other people other Black females who are thinking, what else, what field can I go into in health? I want to be in healthcare, but I don't know where I want to go. Like, I want chiropractic to be one of their options and let them know that you can do this. And then the other thing is I want also Black people to know that there are other alternatives to healthcare, other than just like taking medication and things like that. We are like, every time when we're going up, if I cough, my mom was like, do you want to go to the doctor? And I'm like, no, like, we don't need to go to the doctor for anything. There's other things that we can do for our health. Like, getting a prescription is not the first thing that we need to be reaching for. There's other areas in health and wellness that are super effective that I'm hoping that are starting to come to front now.
Yes, I definitely agree with you on that one because it's so many people in my family that has been misdiagnosed, my mom being one of them.
Mm.
She asked her with bursitis, and that wasn't the case. She actually has a rotator cuff tear. So
Yes.
that's what I'm saying with a lot of like other doctors.
Mm.
They're misdiagnosing a lot of patients.
You're 100% right. And when you get into practice, you will see that. You will see that a patient will come in and they've gone to their family doctor before they come to see you, but there's nothing wrong with that.
Right.
But you will tell them something that might oppose what their family doctor has told them. And we hold family doctors to a certain standard when it comes to health. So sometimes they're going to take that. So now it's your job through your treatment to be able to prove to them why you're saying what you're saying. Because you will see that a lot, a lot. Unfortunately, family doctors are not educated as we are thoroughly on the musculoskeletal system. And so they will probably spew out the common things, sciatica, low back pain, but you, through your treatment, you have to be more detailed and be more specific. And that's how you're going to build trust with the patients.
To my last question, what is some advice you would give to a future chiropractic student?
So the one piece of advice that I would give to any future chiropractor and chiropractor is get a mentor. It is so important.
Mm-hmm.
It is so important to have a mentor. You're going to save yourself so many mistakes. You're going to learn so much. Having a mentor is probably one of the best things that I did for my career. And it's something that really jump-started my career. It is so important to have someone who can mentor you, someone that you can ask questions, someone that you can ask what worked for you, what didn't work for you. My mentor is awesome, and he honestly saved me from a lot of mistakes and things that he had to go through in the beginning of his career that I didn't have to go through. So it is so important to have a mentor, have someone you can bounce ideas off of. That's probably the number one thing that I would say. And then the second thing is you have to keep reading. It's so important. It's so important to stay up on research. You will find that what you learn in school, when you get into a practice, a lot of it is not going to resonate anymore. I did an Instagram live yesterday on posture and how we were taught, oh, bad posture is sinking forward and good posture is standing up straight. Whereas now posture is, can you move into different postures? How well do you move instead of those static postures that we used to tell people to do? And like stretching, we're telling people stretch, stretch, stretch. Stretching doesn't do a lot, right? More working on mobility and strength. So things that you're learning in school right now, research takes a long time before it makes it to the clinic. So what we're learning in school right now was researched 10, 15 years ago. So you have to stay really up to date on research that's happening right now, and you can't do that unless you're reading. So those would probably be my two biggest things: is get a mentor and continue educating yourself. It never stops. You came into a profession of health, you always have to stay up to date on what the research is saying.
Definitely. Well, thank you so much.